That is what separates somebody who is taking home close to 7 figures and somebody who's saying they like dentistry, but they're not bringing home nearly that much because they are dealing with the ceiling of knowledge. What monies do I need to run my business or my associateship absolutely efficiently? Without understanding the numbers that go into our practice, we're not going to survive. We're going to wonder, why aren't we driving that type of car? Why aren't we having that renovated office? What I really like about being a super generalist is at some point in your career when you're doing these procedures, nothing phases you. You can market all you want, but if we're doing fillings instead of crowns that are needed, referring out root canals or extracting those teeth because we're not comfortable with those root canals and we want to get it under our own bill, that's going to halt the growth of the practice. But when you have a dentist that wants to embrace this concept, wants to do it all, look left, look right, look at the quadrants, this is what's going to make dentists have a tremendous career. It's not about money. Money comes. Hello, everybody. Welcome back to Dentistry Beyond the Numbers. If you can tell, I am very excited to be here. Took a few weeks off. My son and my daughter-in-law had a daughter, which makes it my granddaughter, my wife and I, granddaughter, first grandchild. We are over the moon. Just to share some good news personal. I have 3 sons that my wife and I raised and never had a girl in our lives. We're so excited and took a little time off, spent some time, got myself situated, but we're back to Dentistry Beyond the Numbers, and we're going to engage in a 10-week program. The 10-week program is to really dive into what we talked about our first venture, the dental Hamsa. Really this roadmap of having just a quality, exceptional career. This is something that I've thought about for many, many, many years. When I first came out, I'll remind everyone, I had a large practice in New York City, still part of it, and we had specialists. But I've seen through the years, some of my associates, a couple of them mainly, have really embarked on the super general dentist, what we're going to term the super generalist. To me, the super generalist is the future of dentistry. And it is my observation through many years of having associates. And what I've seen is and studied is that a dentist that allows themselves to be able to learn and seek the knowledge of really a well-rounded dentist. And if you look at the 5 digits, the 5 fingers, Invisalign, root canal, crown and bridge cosmetics, surgical extractions, bone graft, and of course, implant placement, the fastest growing procedure in our field. When you embark on those things, you are what I call really a super treatment planner or a comprehensive treatment planner. And what I mean by that is when we're a super generalist, I want patients to know that it doesn't matter to us whether we do a root canal or extraction and bone graft or an implant or a crown or an onlay. We do it all. So the only goal for us is really to do what's best for the patient. And it's so important when we look at that situation, because once you have adapted, and I've seen young and old, I mean, we have partners, I have associates that have embraced this concept and really understanding what it means to be a super generalist. Well, to me, they're the most well-rounded dentists. You know, when I went to University of Pennsylvania, the goal in life was to be a perioprosthesis dentist, to spend the program there and be a dual specialist. I think this is what it's about. This Hamsa puts us on the roadmap for somebody to say, I really want to embrace all aspects. I love surgery, but I understand the importance of crown and bridge. I certainly understand the importance of clear aligners. What I really like about being a super generalist is at some point in your career when you're doing these procedures, nothing phases you. You can do it all and you can handle it. And it's really fascinating to me how we will embrace this and use this as our roadmap. And I've said this before, you know, I look at how we're going to build our new patient load. Are we going to go out and market more? Are we going to blog, reputation, put different videos? It doesn't matter if we up our marketing to $20,000 a month. What happens at the chair is what makes the ROI. You can market all you want, but if we're doing fillings instead of crowns that are needed, if we're referring out root canals or extracting those teeth because we're not comfortable with those root canals and we want to get it under our own bill, our own production, that's going to halt the quality of the practice, the growth of the practice. But when you have a dentist that wants to embrace this concept, wants to do it all. Look left, look right, look at the quadrants. This is what's going to make dentists have a tremendous career. It's not about money. Money comes. That patient will absolutely know exactly who is treatment planning them the right way and who is treatment planning them the way that they know. That is what separates somebody who is taking home above 500 and close to 7 figures and somebody who's saying they like dentistry, but they're not bringing home nearly that much because they are dealing with the ceiling of knowledge. Whoever embarked on this career and wants to envelop and gain that knowledge also understands finances, because they're not going to come to work and run their business without understanding what goes into that business. What monies do I need to run my business or my associateship absolutely efficiently? Without understanding the numbers that go into our practice, we're not going to survive. We're going to be sucking wind for a long time. We're going to wonder, why aren't we driving that type of car? Why aren't we having that renovated office? Because we as dentists need to understand that there's a tremendous difference between understanding and really embracing. Numbers tell the story. Numbers tell the story if the hygienist in that office is probing and advising scaling and root planing and asking for certain procedures like an arrestin procedure or deep cleaning procedure. Are those people, are the hygienists really producing and generating numbers like in the past, or are they not? Are the numbers from marketing really, we're spending $10,000 a month. Are we really getting a 3 to 4 to 1? Are the phones ringing? What are we doing? Let's understand how our payroll is being affected. We are going to dig into this hand like you've never dug in. I want to bring people in to make you understand, the doctors, the teams, that if you institute root canal therapy in your office, you'll do more crown and bridge than you've ever done in your life. Whether it be associate or training, if you're young enough or old enough and willing to embrace it, doing root canal therapy is amazing. Doing Invisalign or clear aligners or orthobrain and understanding the concept of occlusion will help you with future work. We're going to get deep into that. Cosmetics, crown and bridge. If you can understand the concept of the curves of Wilson and Spey and etc., and understand how to deliver an absolutely beautiful case, you're going to be better for it. And of course, surgery. Every young doctor coming out loves surgery, because it is absolutely rewarding when you could take out a tooth, graft it, and put an implant in. And these are the ones that I see are going to embark on building great practices. And if they're associates coming into a practice, we're going to talk about the integration of that today. Because to me, I'm seeing a lot of people being brought into practices and asking, how do I get in if there's a specialist? How do I do the work I want to do? We'll talk about that. But right now, I want to show you something. I have seen many dentists, and let's bring up that x-ray. I have seen many dentists that are making some changes. I am very fortunate to deal with a number of dentists that I feel are really excellent clinicians. Now, if I look at this x-ray and I see tooth number 14, and I'm an average general dentist, I probably wouldn't even address number 19, although we know what has to be done there. So if I'm a dentist who not sure about root canals, and I'm definitely not going to take these teeth out, I'm going to refer almost this entire case, because the tooth number 29 needs a new root canal, or, right, you look at the teeth in the anteriors, they need crown and bridge. Some of them need retreats or extractions and implants. The difference is that if somebody wasn't educated, didn't have the confidence in the 5 procedures, this would be a punt, as opposed to somebody sitting inside and saying, look, the root canal is almost on 19 is almost through the furca with a large PAP. That tooth should come out, grafted, and put an implant in. The tooth number 29 will try to save. Tooth number 14, probably too much decay to save. It's going to need a graft, may have to wait. We'll put an implant in there. The point I'm making is somebody who came to this office is now being referred either out or to another room is so different than one of the super general doctors who have, and she or he have embraced this concept of being somebody that refers out the things that need to be referred out. I'm looking at somebody who comes into the office, and this office has always referred things out. Now you're coming in, or I'm coming in, or somebody's coming in, is now hired as a dentist, and they're fully aware this is a doctor who does those things. Now it's an office change. The whole office is focused. The whole office is excited because now assistants want to assist on surgery. The team wants to collect bigger cases. Production will be enormous. Case in point, doctor goes into a practice, true story. Doctor goes into a practice after 5 days. This doctor produced close to $60,000, $12,000 a day, between 10 and 12,000 a day, 5 days. The owner doctor, after 3 weeks, produced close to 38,000. The difference of production between a super generalist and an excellent general doctor who refers everything out except fillings, crown and bridge, and partials and restoring teeth, as opposed to being a dental Hamsa believer. The difference in production, if you analyze that, is $1.1 million a year. That's the difference. If you annualize that, the doctor just made himself difference from the other doctor of close to 350 above what the other doctor was producing. So the difference of production is astronomical. And the difference of quality, well, it should be no different. And that's what we're going to get into today a little bit. And that is, the integration process. But the entire office needs to understand what it really means to bring in somebody like this. Oh, doctor, is that a filling? No, that's not a filling. That's going to be a quadrant of onlays. I've said this before, and I'll say it again to you doctors. I love onlays. I love it because if you tell a patient that we want to put in a porcelain filling that's going to last a long time and prevent root canal down the road, they will do that, as opposed to another filling that could entail the possibility of drilling on that tooth too many times, causing desiccation, causing the need for root canals. So it's just simple quality of dentistry. We are moving to the quality or the standard of dental care. It's really exciting if you say that the better you are is the better it is for your practice and profession, because you're bringing in a lot more of the ability to produce. And if you take that x-ray, just from that one x-ray, how about missing teeth, partials versus implants? If we're not even going to give them that choice, are we really delivering quality dentistry? And if we don't have it in our office, are we going to refer it out and risk the loss of income? Specialists have a place. Please don't think not. Specialists have a place. But I believe specialists should be doing specialty work today. All on X's, sinus lifts. But the super generalist, it's his or her career to advance, to me, should be doing things that they feel very comfortable and can bring it to the absolute level of where it would be if you send it out to a specialist. And they're really on a single tooth implant. It's integrated, it's straight, it's beautiful, it's done. Doesn't matter how many years we spent in school. If we use a guide, if we use a printed splint, it goes in. So it's very important to understand, we as dentists, as we go and embark on our career, we are fine-tuning our skills and learning our practices and learning what it means to run a practice. It also is an issue. I'm going to tell you why. The interesting thing is, the issue is as good as we think we are. And I'm not talking personally. I'm talking for you, the super generalist. The amazing super generalists that have reached an unbelievable level of production, unbelievable level of knowledge. If you go into a new office, you can't scorch earth. This office you're coming into has specialists, has a lot of people that are focused on sending people to the specialist, whether it be a premolar root canal or a simple extraction and bone graft. That dentist was referring everything out. I do believe that the aspect of integrating into a practice is so important. Those first few days, doctors, that you walk in, you, the well-trained doctor that has an ego, needs to check it at the door, because you're walking into somebody else's home. And you have to go and, like I like to say, you crawl, you walk, you run. You don't come in and start ripping apart the whole scenario and the whole the whole aspect and philosophy of the practice. If you come in and start treatment planning everything your way, you're going to make some enemies. You're going to make some relationships that will struggle to get back on the right track. When you walk into that office, there's a plan, there's a philosophy, learn it. Then start instituting your super general powers of doing a lot more procedures. What happens when somebody has a specialist? I'm really a firm believer in that. You come in, you want to learn. You want to really get in the good graces of everyone, but you also want to learn. If they have a periodontal surgeon who are doing some larger cases, send them a case. Send them a simple case. Tell them you want to learn how they're doing it. It's sort of like, tipping the maitre d'. I mean, in a higher form. And what I mean by that is you want a great seat and you want to be remembered and you want to be respected. If you come in and take those implants right away, you have just disintegrated that possible relationship. But if you go slow, eventually you're going to tell them that you're trained to do implants. You're going to tell them that you're ready to do, or her, you're going to ready to do some more cases. And slowly you'll have a fan because the avenue is open. And if there's a larger case with some sinus lifts, maybe an all-on-X, refer it, study it, learn it. Remember, this is a marathon, not a sprint. And if you really like the practice, just take it time, win over the team, educate your staff, your team, that how you want things. Talk to the hygienist, how we're going to integrate these procedures into our armamentarium. And we want to make sure he or she knows that so they could talk about it. Well, let the doctor talk to you about this because I know Dr. Jones, he's going to be wonderful. She's going to be fantastic. They do everything. Really? Yeah, everything. They're great. And that's what we want to do. We want to integrate this situation. So it's really a situation where we're at the peak of our ability to grow, at peak at our ability to really, really take command of the practice. I feel like I see so many things coming on and associates are asked to do this and that, but really you need a focus. Your focus is to get respect. Well, the first thing an office needs to know is this doctor is going to deliver quality care to our patients. Once that happens, you got referrals. Once the specialists feel good, you got what you need. Let it come to you. Don't think day one, you got to produce 20 grand. Day one, you've got to be accepted. Day 21, you're going to be doing great work. So it is not just going in there and, just doing everything. It's learning the philosophy, making people realize that we are here to build the practice, to grow the practice. Yes, to make a lot of money. Yes, to build our careers, but we want to do it the right way. Integrate. Do not disintegrate that practice. And from there, we will gravitate our knowledge, our earnings, and our career. So with that, my goal is really to really build you. There are certain things that I haven't even touched on, and that is the building of communication. I've said this many, many times. I wasn't a surgical general dentist. I had a specialist. If I could do it over again, I would learn how to do implants because to me, I was too gracious to my specialists. They were great. They were the best. I loved working with them. But at the same token, today, we need to learn how to do implants because implants became much more easy to operate, more defined, more definitive with the advent of surgical printers, surgical stents, and do it chairside and do it same day. It's amazing. Communication will get us those cases. Knowledge gained. I mean, we're embarking on a situation where you're going to be able to go out and learn this, and so much knowledge. Integration of the procedures in the office and carrying out fantastic results from our chair. There's so much to do in dentistry, so much to learn. But to have no ceiling of knowledge, to have no ceiling, you could keep learning and learning and learning. It's the true meaning why we call it a practice. Because we can learn so much. And when we're done with that, there's more innovation. There's more technology. AI is coming. Very important to understand that this is a career, not a month. Next episode, we are going to have Dr. Dan Gurman, and I'm hoping he will be the first one up. And the reason is because if you look at our Hamsa, clear aligners is number one. Why is clear aligners number one? I believe clear aligners is foundational. For us to do clear aligners, we need to understand occlusion. We need to understand form and function. And that takes us to the next level, foundation, root canal therapy. What it means for a doctor to be able to do root canal on a vital tooth and that same day post it and crown it. What it means for a doctor to do it and not lose that patient out the door to a referral, that we can do it. Not tortuous, not calcified, not a retreat. I'm talking straight root canals from 2 to 31. I think we can learn how to do that, especially with the advent of rotary. We're going to bring on rotary experts to understand the importance of integrating that into the practice. Crown and bridge cosmetics, surgical extractions, and prosthetics of implants, implant placement. So we're then going to embark on the practice itself, understanding the necessary needs for this, the need to understand the concept of doing these procedures, the foundation, the phase 1, phase 2, and how that could be used to sell or to treat and plan and then sell a case to a patient. I meet a lot of dentists, and I find for the most part, dentists are very smart, very educated, and know their business. They want to practice efficiency. They want financial sustainability. We want practices that we walk in and we say, oh, it's not a 15. It's a very productive day. It's not 15, but it's 12. Today is 22. Tomorrow's whatever the numbers may be. It makes us happy. Whatever dentist feels their number is, that makes them successful. And that's what it says. The man or woman who's happy with their plot, whether their plot is a $5,000 day or a $25,000 day, they are a successful clinician. That's my opinion. You want to grow it? That's what we're here for. Work-life balance, so important. I respect so many people that were able to keep that throughout their career and continue to do that. Kudos. It's amazing. And it's really what you're looking for in life. Especially as I started, my family is expanding. My work-life balance needs to be better. And a great exit. No matter how we exit, I want to give you the best exit. And if I can embark a little bit of knowledge, that I've had a number of transactions. We've gone through that. So if I can help you, please reach out. I want to put in front of you, my listeners, the best way and the avenue to really grow your personal advancement, your personal gain, and eventually what you look for in your career. Everyone is different. Not everybody drives a Mercedes, but the one who's driving a Lexus is very happy, or a Toyota. As long as you're happy, that's the best. And that's what we go for. That's what we wake up for. All I know is what's done at the chair. I'm not an expert in marketing. I'm not an expert in buying supplies. I believe I'm an expert in building dentists to the peak of their careers and helping practices gain in revenue and subsequently exiting. So that's what we're going to do. We're going to be embarking on so much knowledge that it is going to be great. And one day, I will tell you a little secret. I really believe there should be a residency, either at night or once a week, over a 3-year period, that teaches dentists every one of these digits. And when you come out of that 3-year program, you are knowledgeable in every aspect. Think about that. You come out knowing how to treat almost every situation at your chair. How amazing would that be? Really, I think that's the future. I hope. I like it. I think about it. And by the end of this, I believe that if you need help, you'll call me. But if you go back and take these lessons from great people that are going to come join us, you are going to elevate. I like those 8s. Integrate, don't disintegrate, and elevate your personal growth. That's what we're in for. That's what we're going to embark on. And that's what we seek on Dentistry Beyond the Numbers. I'll see you there. Thank you so much.